My name is Dr. Josef Thundiyil. I'm an emergency physician and a medical toxicologist. Many people know someone or related to someone or they themselves has had a struggle with opioid addiction. I think the take-home message is anyone is susceptible. I think it's fallacy to think that you're the person who's not. When you have a disease, you have to manage it. There's a treatment that works and there's a way to success. And like everything else, we want to reduce morbidity from any disease, including addiction. We want to reduce mortality from any disease. Opioid use disorder treatment works in several ways. There's different forms of it. But what I'll talk about a little bit more is what's known as medication-assisted treatment, which has become increasingly popular and found to be increasingly successful in the treatment. The goal with medication-assisted treatment is to take someone away from that need to have to constantly seek out the satisfaction for that craving that they have, and to replace it with a couple different options. One option is something like methadone. Methadone is another opioid that's like heroin and fentanyl and Percocets or oxycodones. But methadone, rather than having such dramatic highs and lows with the use of the drug, has a much more constant, long-lasting effect. So it can satisfy the craving without the need for addiction and chronic relapsing states of euphoria and withdrawal. Another one that's become a lot more popular is what's known as buprenorphine or Suboxone. Suboxone and buprenorphine work a little bit different because it's a partial opioid, but also an agonist, but also an antagonist. So what that means is it binds to the same receptor in the brain that an opioid would bind to, but rather than stimulating it at such a high level, it stimulates it at a level enough to reduce the craving, but not to give the euphoria. And it's simultaneously an antagonist. Functionally, what that means is if you're someone who's on buprenorphine and then you try on top of that to use heroin or some other drug, it will be hard to really get that high effect because the buprenorphine is binding so strongly onto those opioid receptors that you likely not get that same level of high. The other important part with buprenorphine that we particularly like as physicians is it makes the likelihood of overdose deaths extremely, extremely low. Number one, because as I mentioned, they can't use concomitantly another drug and be at risk for overdose. The other is that the buprenorphine receptor stimulates that opioid receptor but does not cause the same level of respiratory depression. And the reason why is because it hits a ceiling effect. The goal with treatment is to move away from that process of addiction and more towards dependence and eventually, obviously, freedom. So those are the main principles behind using medication-assisted treatment.